Okay, so I'm delighted to welcome you this afternoon if you're in North America and late evening if you're in Europe, um, to this special session of the What Works Global Summit, where we're going to discuss the Global Commission on Evidence to Address Societal Challenges. My name is Jeremy Grimshaw. I have been the co-lead of the Evidence Commission Secretariat over the last 18 months. I'm also a senior scientist at the Honourable Hospital Research Institute in Canada, and I'm also the president of the board of the Cameroon collaboration. So it's a great pleasure to be here with you today, and I'd like to recognise my colleagues in the Evidence Commission, John Lavis and Jen Verma. The plan for today is that I will start with a presentation for about 20 minutes, which will walk you through the Evidence Commission and what we've done there. And then we're going to ask, we have three discussants who are going to talk through or pick up on aspects of the Evidence Commission from their perspective. The first will be Maureen Smith, who's a citizen leader from Ottawa in Canada and was one of the commissioners on the Evidence Commission and is a very passionate advocate for ensuring that citizens have access to knowledge to inform their decisions, how are engaged in those processes. Then Jan Minx. So Jan is a climate scientist. He works in the Mercator Institute in Berlin. He's also the co-chair of the Cameroon Climate Solutions Group. And again, he was one of our evidence commissioners, making sure that issues such as climate change and climate solutions was considered alongside all the other aspects of human enterprise. And then our final discussant will be Patrick Okwen. Patrick is the team lead of the Effective Basic Services, also known as eBASE in Africa in Cameroon, which has really, I think, done some highly innovative work thinking about translating knowledge to local communities using traditional forms of engagement and knowledge transfer across a broad range of areas, including things like currently working on gender-based violence and other factors such as that. So we have a good session today, and I do hope you will enjoy it as we move forward. So that's really what, and then after that, sorry, I should say, we'd really like to have some discussion with you. As we go through the session, can you use the question and answer box to put any questions in that you've got? And then also at the end, you'll have the opportunity to contribute to the discussion. So I'm going to start off by talking a little bit about the Evidence Commission. The Global Commission on Evidence to Address Societal Challenges, we started this work around about actually 12 months ago, and we published the report in January of this year. The original impetus for the Evidence Commission and its report came from our experiences of the COVID-End network during the current pandemic. So COVID-End was an umbrella network that tried to bring together many of the world's leading evidence synthesis, evidence recommendations, evidence intermediary organizations to see if we could better coordinate and encourage cooperation in the evidence response to the pandemic to support decisions by citizens, practitioners, and policymakers. We had a very broad range of participants, and you can see here we're just highlighting some, such as the African Centre for Evidence, the Campbell Collaboration, Cochrane, Guidelines International Network, and together we had over 55 partners from around the world who are all coming together to see if we could basically improve how we coordinated the evidence response. And again, these are just the logos of some, not all of the organizations we have, and you'll see a very broad base both across sort of sectors, so not just health, but also the Campbell collaboration on evidence in the environment, the epicenter, and also geographic spread from Africa to Asia to Latin America to Europe and North America. So it's a very broad perspective. So when we set up COVIDEND, we were aware that there were a number of challenges that we faced in the evidence synthesis community during the early days of the pandemic. In particular, there was a huge amount of work that was being undertaken, but it's of variable quality. It was rapidly out of date. There's very little coordination, which meant there's a huge amount of duplication. So there were some problems that we thought we needed fixing. But we also identified a lot of really innovative practice, a lot of things which, people during the pandemic were finding new solutions to a lot of our pre-existing problems, and often finding new efficiencies in terms of how we could do evidence syntheses and evidence support systems. And so what we wanted to do was to make sure that we learned from our experience in the pandemic and thought about what this might mean for future evidence support systems. So we wanted to set up the Evidence Commission to consider how to build a better evidence support system that meet the needs of diverse stakeholders. And here we're interested in citizens, practitioners and policymakers, and also across all sectors. So a lot of the emphasis in the early days of the pandemic was on health, but we think the arguments about needing better evidence support systems go way beyond health and are important across all aspects of human endeavors. So we brought together a commission of 25 commissioners from very diverse backgrounds. So probably about a quarter of them did come from health, but the rest came from climate change, from social welfare, from engineering, from education. And we had governmental leaders, we had organizational and practitioner leaders, and we had citizens and not-for-profits as part of that. And we asked them to help us think about how could we do better in terms of providing evidence support systems for the world as we come out of the pandemic. As I mentioned, the report was published earlier this year, and it's now available in the 6 WHO official languages and also Portuguese. And I'll give you all the details about where you can download it at the end of my talk. This is our wonderful list of commissioners. I've already talked a little bit about who they are, but Fitsum is a cross-government minister in Ethiopia, who brings a whole of government perspective, for example, thinking about how one might use evidence. Gillian Leng is a former CEO of the National Institute of Clinical and Social Excellence in the UK. Jan Minx we're going to hear about. Many people know Howard White, who's a former CEO of the Campbell collaboration. Hadika Bashir was a young leader advocating for girls' rights and gender equality in Pakistan. And so you can see there's this great breadth of experience. And frankly, it was just interesting to be in the room with this group of people, virtually, of course, whilst we actually thought about how we might want to take things forward. And that's just to point out that Jan and Maureen were commissioners again. So when we started off, we identified that we wanted to make sure that the Evidence Commission considered 4 different types of decision makers. Too often when we think about evidence synthesis, we focus on a single decision maker. How do we support policymakers, without recognizing that actually we need a solution that meets the needs of all these different groups? So that was very important for us. We also recognized, although a strong emphasis of the Global Commission was that we need evidence syntheses of diverse types of knowledge, we also recognize that there are many different types of research which are relevant to making better informed decisions about policies and practices. And so whilst we see evidence syntheses as a way to summarize these different types of evidence, we do want to recognize the breadth of knowledge that is required if we're going to make better decisions in the future. And this is just to highlight that we wanted to go beyond COVID and also beyond health. So, we wanted to think about how do you support decision makers who are, trying to work out how to provide virtual instruction to schools. How do we address sort of the growing inequities during the pandemic, where those who have less have actually suffered more in terms of what we've got? How do we address gender-based violence? What knowledge is needed to rebuild the trust in institutions? So you can see, the landscape we're trying to paint is very, very broad. So, and this is also just highlighting it wasn't just us that was focusing in this area. So I think this was at the end of last year. The UN produced a research roadmap for the COVID-19 recovery. And this is really talking about how, as we come out of the pandemic, we can basically try and catch up and further promote the Sustainable Development Goals. And within the report, it highlights these 4 basic or main pillars for how to do that. And these include rapid learning systems and knowledge mobilization, both of which talk to the need to use the existing evidence base to inform future decisions about how to provide services and policies. So we were reflecting a lot on what we'd experienced during the pandemic. And what we observed was that certainly in many jurisdictions, instead of looking for best evidence, for high quality evidence syntheses about what we know about a problem, people often chased single studies. We were very dependent on expert opinion or panels, or just doing jurisdictional scans. What are other countries doing? Rather than sort of saying, do we have any evidence that can help us in our decision making? Now, clearly, right at the start of the pandemic, we had very little evidence. But the research enterprise over the last 24 months has been so amazing that we have, a lot of research evidence out there that we can learn from and summarize. And unfortunately, a lot of that is not necessarily high quality. So again, we need to be very particular users of research, trying to identify high quality evidence that we can base our decisions on. And evidence syntheses, again, help us do that. We also, on the right-hand side of the screen, observed that there's a lot of emphasis on data analytics, modeling, and evaluation, all really important types of knowledge that we needed during the pandemic, but there's much less emphasis on implementation and behavioral research or qualitative insight or evidence synthesis. And again, it suggested that, during the pandemic, we probably didn't do our best efforts at sort of using the available evidence to inform what we should be doing. So the emphasis of the Global Commission report is basically how do we develop better evidence support systems. And by evidence support systems, we distinguish that from the research system. So those sort of peer-reviewed funded research in countries, which really doesn't often directly interface with decision makers. The innovation system, which is often sort of trying to develop innovative models, but again, isn't really thinking about how can we provide evidence to support government and other decision makers in our jurisdiction. So we believe that the evidence support system should include things like evidence support units that combine the power of national evidence and global evidence, expert panels that are very broad-based, where they actually consider pre-circulated evidence summaries rather than just depending upon their tacit knowledge, government science providers that speak in a way that makes it possible to judge their accuracy, and a range of processes to improve how we can access and use knowledge. The Evidence Commission came up with 24 recommendations, and we've identified sort of 8 that we think are most important, but you can see they cover a range of stakeholders from everybody, a call for action, but also multilateral organizations, governments, organizational leaders and citizens, those evidence intermediary groups like eBASE, for example, as well as the evidence producers and funders. And I want in the last few minutes of my talk to talk a little bit about the recommendation, some examples of the recommendations. So the first recommendation was just a wake-up call. basically sort of saying we need the world and decision makers, evidence intermediaries, evidence producers to recognize the scale and nature of the problem. We are not maximizing the learning from current knowledge. And if we want to have a better society and build a better and fairer world, then we need to do this better in the future. The second, or the range of recommendations focusing on multilateral organizations like the UN, G20, and other multilateral organizations. And we suggested they should endorse a resolution that commits them and their member states to broaden their conception of evidence and to support evidence-based global public goods and equitably distributed capacities to reduce, share, and use evidence. Again, one of the things that came through the pandemic is that the abilities of different countries to make best use of evidence was very variable, and particularly colleagues in low and middle income countries were really challenged by very practical issues, but also capacity issues to be able to lever knowledge. And we need to build a world where there's equitable capacity to find and use knowledge. At the national level or subnational level, we argued that every national government should review their existing evidence support systems and broader evidence infrastructure and fill the gaps both internally and also through partnerships, and they should be held to account to their citizens and publicly report on their progress about how to do that. From the point of view of organizational leaders, professionals, and citizens, this is particularly talking about citizens, but we need to find ways of supporting and enabling citizens so they can make decisions about their and their family's well-being based on the best evidence. And they spend their money on products and services that are backed by best evidence. And if they're volunteering their time, again, they are and donating money to initiatives, they should be making use of evidence to support those. And they should also be challenging and holding into account politicians to make sure that they're using best evidence. We also thought that governments, foundations, and other funders should spend smarter and ideally more on evidence support. Imagine if 1% of the global research infrastructure funding was dedicated to evidence infrastructures, and also we ensured that that was distributed in a way that facilitated equitable capacity across the world to use evidence better. So those were some examples of the priorities. As I said, there's 25 of them. Please go back, 24 of them rather. Please go look at the Evidence Commission report and see if there are things there that would be useful. In the last 2 minutes, I just want to talk about some of the work that we have been taking forward in the Evidence Commission to try and push this work forward. So the first thing that we have done is I've been thinking about how can we basically formalize and strengthen domestic evidence support systems. And so one of the ways that we're trying to stimulate debate here is by doing rapid jurisdictional assessments, working in 20 jurisdictions in total. That's what we plan. We're currently working in 12. And what we're doing there is starting to look at, well, what are the kind of structures and processes governments currently have in place to try and lever knowledge and evidence? And what are the opportunities to enhance that, to ensure that in the future, they build better structures and systems that will support them better. And there's a whole range of ways in which we're doing that. In Canada, we have gone out and we've talked to now, I think, over 50 quite senior civil servants in the federal government. And this is just a breadth of the different groups within the government that we've gone out to talk about. And it's been very interesting in general. These the people that we've been talking to are very interested, very committed to the idea about how can they use evidence better. And I think we're starting to find some ideas of good practice that might be able to be used that will make sure that we have a much better evidence support system within the federal government. We also are trying to think about how we can better coordinate both funding for evidence synthesis and evidence support systems and also the activities as well. So that, for example, at the funding level, we've been meeting with diverse funders. We're trying to identify lessons learned from existing models, such as the GLOPIDAR, or the Global Alliance for Chronic Diseases, or JPIMR, where different funders are pooling funding resources to basically build a shared research enterprise. Imagine what would happen if we could do that globally for evidence support systems. We would very rapidly, I think, start to develop a much more robust system for there. And so what we'd like to do is identify a lead funder that could promote some initial investment in a proof of principle model, and then basically pursue this further. The other area that we are working on is in particular thinking about that citizen piece. How do you put evidence at the center for everyday life? And this is where Maureen Smith will talk about this in much more detail, because she has a major leadership role within this. And so far we've established a citizen panel that's advising us on this. We've been looking at what's out there in terms of and putting resources on a website, but we've also been going out and starting to identify fellow travelers, citizens serving NGOs that would be, we think would be interested in working with us to see how we can do a better job in the future. And Maureen is going to tell us more about that just in a minute or so. So that's what I wanted to talk about just now. What I'm going to do is just stop sharing and introduce my very good colleague and friend, Maureen Smith. And as I said, Maureen, you'll get a sense about what a remarkable individual she is and her passion. But she has been someone who has been working with Covidend and the Evans Commission now for almost 2 years, and has dramatically changed how we see the world and what we do to make us much more committed and working to ensure that we are really trying to serve citizens as well as other decision makers. So Maureen, I'll hand over to you now.
Thanks for the introduction, Jeremy. So what a pleasure it is to me to be here with you today to discuss how the Evidence Commission is engaging citizens and the recommendation that's important to me, putting evidence at the center of everyday life. First, please allow me to tell you a little bit about myself and my journey to becoming one of the 3 citizen representatives on the Global Commission. So first and foremost, I'm a frequent user of the healthcare system, subsequent to a diagnosis with a rare chronic metabolic disease in childhood. I spent 10 years of my childhood on a longitudinal study, so I was exposed to evidence at an early age. I also lived through a very challenging period of 20 years when there was no evidence about aging with my condition. So needless to say, evidence has been at the center of my everyday life, but unfortunately, it's not the case for everyone. My interest in evidence led me to Cochrane, where I now chair the Cochrane Consumer Network Executive Committee and have the incredible opportunity to interact with consumers from around the world, including my fellow executive members who are from 5 different continents. The decisions that patients and citizens had to make, everyday people like my 91-year-old aunt and some friends who were probably thinking about science and evidence during the pandemic for the first time, were unprecedented. There was a need for greater understanding of evidence, evidence that was accessible, and actual engagement in the evidence enterprise. I conveyed this to Jeremy Grimshaw and John Lavis, and well, presto, I was co-leading the Covidend citizen engagement. Big lesson learned there. To say that has been a turning point for me is really an understatement. The learnings from interacting with and listening to fellow citizens have shaped my thinking and lit a fire in me that will be hard to extinguish. The Global Commission on Evidence has the potential to harness the incredible work that has been accomplished and learn from errors. For citizens like me, it's an opportunity to develop a culture of evidence, which I think is necessary to working towards a world where evidence is at the center of everyday life. And just a short side note, if you're following the work and recommendations of the Global Commission on Evidence, You may have noticed that it has dared to thrust open the doors of the evidence ecosystem to non-traditional partnerships involving citizens. The Evidence Commission's analysis of past global commissions found limited engagement of citizens in all aspects of their work. Citizens were the least frequent target audience, commission members, and focus of broader engagement. Have been invited to be a commissioner along with Hadika Bashir, a young advocate from Pakistan, and Danielle Eberi Alves da Silva, an indigenous environmentalist from Brazil, suggests an evolution in the approach to partnerships with citizens. Commission has also broadened the scope to include all societal challenges. So the pandemic has certainly highlighted this interconnectivity. So what are we doing to advance recommendation 13, the use of evidence in everyday life? Well, we formed a citizen leadership group, a global group of citizen leaders, which I chair along with Modupe Adufiso Olatiju, which we convene to advise on the Secretariat's work with this implementation priority. So by the end of 2022, we have 3 goals. So add key resources for citizens and citizen-serving organizations to the Evidence Commission website. Secondly, further develop relationships with citizen-serving organizations. And finally, host a few webinars or presentations to further the reach of our efforts. We're also very aware that we are, in essence, competing with misinformation, disinformation, and infodemics. Sadly, these antitheses to evidence are well equipped to reach citizens and make the greatest impression on the very people who are the most vulnerable to the negative consequences of decisions that are not based on evidence. The Evidence Commission's approach is to shine a bright light on the alternative, evidence, and promote environments where it becomes the default choice. One of the most exciting developments in the past few months has been the meetings that our Evidence Commission Secretariat and either Modupe or myself attend with a number of organizations that share a commitment to the use of evidence for citizens. Jeremy, if you would kindly put up that slide with the list of organizations who we've met with so far.
It's up, Maureen.
Oh, thank you, Jeremy. So there are so many synergies, and we're looking forward to fruitful collaborations. You have no idea how exciting these meetings are. It takes me about 2 hours to come back down to earth after I've met with these groups who are doing incredible work that in many cases we weren't even aware of. That's the key. So one thing that the pandemic has taught us is that we are stronger when we collaborate. So on the home front, this week, the McMaster Health Forum will host 2 half-day citizen panels that focus on environmental, structural, and systemic factors that can help to put evidence at the center of everyday life. We look forward to engaging with citizens and learning how they view evidence and the barriers and facilitators to using it. It is only through listening to citizens and understanding their needs that we can begin to address the use of evidence. And of course, this has to be done in all different contexts. In closing, it is really the support systems that we put in place, informed by processes of co-production that are adapted to the unique needs of citizens in the evidence ecosystem, that will advance the use of evidence in everyday life. Thanks so much for the opportunity, Jeremy.
Wow, thank you, Maureen. And I'm sure people on the meeting realize why it's such an honor, privilege, and joy to work with you from that. So we're going to move on, and our next discussant is Jan Minx. I rather garbled, I think, his titles before. So just to say, he's the head of the research group for applied sustainability sciences at the Mercator Research Institute on Global Commons and Climate Change in Berlin. This is we think this is a very interesting sector because in many ways the climate change community is very, very sophisticated in, say, their models, but they may not have had the same, not as sophisticated in other areas, such as thinking about systematic reviews of mitigation factors. And in fact, Jan is now taking a global leadership role in terms of saying, how can we ensure that as we move forward, we're using all types of evidence to sort of improve our decision making about how to try and save the planet. So Jan, I'll hand over to you, but tell me when you want me to share your slides.
Thank you, Jeremy, and hello, everybody. It's a real honor and pleasure to be here. Jeremy, the slides you can share right away, actually.
Okay.
Maybe just to get started, as Jeremy highlighted, the climate sector is actually a sector which is a good example where evidence has been used quite consistently. So we couldn't actually think of progress in international climate policy with organizations such as the Intergovernmental Panel on Climate Change that has been using evidence very, very consistently, and actually as an institution at a science policy interface, it's also kind of an international flagship, I would say. And this is probably also my personal history of coming to this, to evidence synthesis, coming more from the field of environmental assessments. And this is what you can see here in the in this pyramid, where we have primary research at the bottom, and then we have this field of evidence synthesis where we want really high quality reviews, right? But then organizations like the IPCC, they are sitting on top of that. They are supposed to really assess the state of the climate science, and in a sense, they're really dependent on high quality evidence synthesis going on in that middle layer. And why we actually decided a couple of years ago to start the Cameroon Group on Climate Solutions is because there is a gap in that pyramid, as Jeremy already has highlighted. So the IPCC and the whole climate community has been really, really good in understanding alternative futures via what and the major vehicle of evidence synthesis are actually model intercomparison exercises, where modeling teams, really very systematically assess alternative futures, and that ranges from basic climate science to really exploring solution spaces. But what we are not very good in as a community is, to really understand interventions, what works under what conditions and why. So what works questions are really questions that have no tradition to be answered with high quality reviews in that space. And this is what we really need, because in a sense, just to give you a sense of the urgency of the matter is that we have been growing emissions like for 200 years now, and we still haven't peaked. And if we want to keep temperatures below 1.5 degrees, for example, then we have about 30 years left to go back to net zero emissions. So that's really means that we need to transform life in all aspects, but we need to transform our economies, and we have limited resources and we have limited time. So we better ought to make very few mistakes. So high quality evidence systems are like super important. Next slide, please. And I'm deeply convinced that that we really can get to an enhanced system or that we can get to enhanced evidence synthesis if this community on the left-hand side, which is kind of the climate and global environmental assessment community, and the collaborations basically reach out to each other and learn from each other, talk to each other. And this is really something that we want to explore in the Climate Solutions Group, but also which was a real motivation within the Evidence Commission, why that sector was so interesting, because it's not only that there is this kind of ex ante, so future related evidence and the and the evidence related more to the past and to the what works, but they are all also interconnected, right? When, for example, in the climate space, we have to calibrate a lot of models, and we need also for these calibration exercises the best available evidence, and that must come from rigorous evidence synthesis methods. Next slide, please. And so one way of, one thing that we try to do now in order to move ahead is to organize this big summit next year. Actually, during the 6th assessment cycle, this is the IPCC assessment cycle that is now closing. We did in 2018 a first workshop where we also had some collaboration representation, and we gathered parts of the climate community to do more systematic review work, and with some success, triggering a couple of special issues with 40-50 contributions overall, which was nice. But now we really want to scale this up and become serious about it. We really want to start evidence ecosystems where we have interrelated systematic reviews on certain topics that arise around this what works questions. We are very thrilled to have an excellent scientific steering group committee, which has both the environmental assessment community, but also the evidence synthesis communities. And so as such, we also want to use that summit to have this ongoing collaboration between, to initiate this dialogue between those two communities who have been living side by side, but who really ought to talk. And we will facilitate this through a variety of formats that enable basically those kind of discussions. I can only warmly invite everybody to join that, but I also want to highlight actually the contribution of the Evidence Commission through this, and also our intention to pursue some of those aspects that I just highlighted in moving forward, where we can really try and connect between those two different evidence synthesis traditions and come up with something that helps everybody to move into to make the next step towards more rigorous and better informed decision making. Thanks so much.
Great. I think we lost our chair, so I'll just step in. I'm Vivian Welch, Editor-in-Chief and Interim CEO of the Camel Collaboration. Jeremy Grimshaw is just reconnecting. His line went down. And I think Patrick Okwen's line has also gone. So maybe while we're waiting for Jeremy to join back, we could have a look at the live Q&A. There is already one question from Kate Nyhan. I hope I'm saying your name correctly. Great talk so far. Question, does the evidence synthesis ecosystem have enough high quality raw material to do robust reviews of BSE topics, so behavioral, environmental, and social science interventions? Maybe, Jan, I could put that to you first in the area of climate solutions.
Yeah, I mean, that's a good question. I think having rigorous primary evidence is a real challenge in some areas. So, for example, there are spaces, first of all, we always find in our reviews that there's a lot of, low quality evidence, but in many areas there are also quite a number of high quality studies. What's interesting, I think, are certain fields where basically where we use a lot of observational data, where the sample size is often kind of inherently limited, and we really have problems of statistical power in the evidence. So there's lots of p hacking going on, and but it's as such not a thing that can be necessarily easily be resolved. So it depends a little bit on the question. But in the climate space, I would say overall, there is so little rigorous evidence synthesis. There are lots of spaces where we need to do good work together to synthesize that.
Jeremy, welcome back. I just stepped in this chair while you and Patrick both dropped off. And we just took one question from the live Q&A about, is there enough high quality evidence to really do robust reviews in social science topics?
Could I add to what Jan said? I completely agree with what he said, but I think also there's actually, in some places, there's more evidence we might anticipate. So we've been doing a review of something called basically conditional plans. It's a way of helping people act upon their motivations to actually achieve behavior change. And there are hundreds of trials in relation to that as an area. And that would be a really good example where, say, during the pandemic, we wanted to know how do you enable people to act on their motivations to maybe mask or social distance, but don't do it. So there are blocks of evidence there. The other thing I would say is I think we sometimes undervalue sparse or even no study reviews. If you do a good review, often what you start to do within that, when you're creating the logic model of what the interventions are that you're interested in, you're starting to provide ideas that are going to be helpful for decision makers. We've not found a lot of evidence specifically in this area, but here's a way you can think about the problem, whether you agree or not. But I think it's often a very useful sort of area where empty reviews can still provide a strong stimulus for decision makers, because I think in this area where we're talking about complex interventions, be instrumental use of reviews, but rather we're using review, that we've got an answer, a specific answer for our context, but rather we're trying to generate reviews that can help people to think better. And so I think, even if you don't have lots of evidence that gives you a clear answer, I think a lot of the review processes can help people think better. But maybe Patrick's back. Patrick, you and I both disappeared from the world, from the virtual world at the same time. So maybe what we could do before we all disappear again is ask you to just get to comment from your perspective. And you have so many different ways that you could bring wisdom to this. But what are your reactions to some of the things you've heard from the Evidence Commission?
Okay, thank you very much. I'm quite happy, very happy to be on this panel today, and especially to give my perspective looking at the global on evidence, and to say particularly that the important thing is focusing on addressing societal challenges beyond just healthcare. Healthcare itself is interrelated, but it's important that we look at it from a broad from the broad perspective of societal challenges. So I actually worked quite much in the earlier part of the COVID end, but moving on to the Global Commission on Evidence, I was not so much engaged. But what I could bring to these discussions today is mostly the LMIC perspective, and especially looking at aspects around evidence, cost of generating evidence, cost of synthesizing evidence, up to cost of implementing evidence. Generally, the most expensive part is the generation of the evidence. And so we start off in LMIC with a shortage or plenty of gaps in evidence that has been generated. But the interesting thing is that when you look at global research evidence, there are actually more similarities than there are differences. Although the little differences that you have could actually make the difference between what works and what does not work. So it's very important to not forget the fact that there are similarities that we can build on, and that we have to be very careful with the differences in the context. And in essence, when we started off at eBASE, we've been working for a long time over trying to figure out how can we get evidence that is good for the context to policymakers, to practitioners, and to the public. This challenge, the challenge has always been, because there's not so much money, not so much finance, you have to think about what matters. And when you are able to map out what matters, you begin to ask what works for what matters. And that has been the perspective that we have taken for all this while. Now, the importance of having equity in the evidence supply system globally is that the weaker parts, or the parts where there are components of the evidence ecosystem, and particularly evidence generation, is weak financially. This can be built upon using innovations that can facilitate transferability across contexts. And this is what leaves us most of the times in LMIC with no choice than thinking about how to innovate. Our innovations may not be so much at the global front, although they still benefit the global front, but they are quite critical if we want to see things working. And at eBASE, we've explored quite a number of innovations, developing tools that can predict transferability of meta-analysis from one context to the other. Also developing policy events that can facilitate the movement of research evidence directly to the tables of the policymakers based on our response to their needs. And then using storytelling to also communicate research evidence to people who cannot read and write and the general public. And then also using audits and feedback to reach out to practitioners in health, in education, and in other contexts. And then we are also looking at the potentials for having knowledge translation units that are actually based at the ministries or at the government that we can support from a distance, so that this gives them more autonomy about identifying their research needs and moving forward. And finally, I'll just quickly dwell on our challenges, the challenges that we have faced during this period. And one of the key challenges is understanding the gaps in the evidence, understanding what matters, and then understanding what works for what matters. And this has been very tricky for us as we moved forward. And sometimes some of the innovations that we have used have helped us to understand exactly what gaps we should prioritize. Now, it's also very difficult for us to compete at the global stage for funding because we do need funding to be able to move forward, to even convince the policymakers that it's important for them to work with us, to bring their priorities so we could identify what knowledge is out there, contextualize it, and then transfer this to facilitate policies that are evidence-based. They don't understand. So we normally say that evidence is still weak. And for us to be able to ignite this, we do need funding. And once we can get that funding to ignite this, then the governments could begin to invest in this. But to get that funding at global stage is particularly challenging. And the local funders that we have, like the World Bank, UNICEF, that are very active in development, they themselves also need to improve their literacy in evidence use before they will be able to invest in that funding. Meaning that networks like the Global Commission on Evidence, RecMaps, which we work with, are particularly very important in working or pulling us across or working with us and understanding our needs. And then like this, we'll be able to ignite what is needed to change the game in evidence use in our context. Thank you.
Wonderful. Thanks a lot, Patrick. That was there's a lot there. Right. So we have about 10 minutes left for discussion. What we want to do is we want to make sure before we come to the end of the call that we ask Maureen also to talk about sparse reviews. But what I want to do is see whether there's any responses or ideas that people in the audience have of what we've heard. You can, I think, if you can put your hand up and we can ask you to then comment. I am aware that a number of you have had a very long day today, and a long day on Zoom calls is like a long week for most of us. So you may not want to, you may be feeling tired. But where else are you going to have the opportunity to ask questions of people like Patrick Okwen, Jan Minx, and Maureen Smith? So any questions or comments or views from the audience? I'm actually very tempted to ask some people to respond, but I'm being good so far. While we're waiting, and I will call someone out. But Maureen, we were asked what happened where you're looking at end up having reviews as quite sparse information, and I talked a little bit about whether they may still be helpful for our thinking. But I think it'd be interesting from a citizen perspective, where you do find there's not really evidence. How do you feel about that? How do you make sense of that as a space? What response can you make?
It's a really good question, Jeremy. You'd have to be a very sophisticated citizen to really understand the evidence and how much evidence there was. So the point that I want to make is that we have to start from the bare bones. And I'm right now co-leading a course on evidence synthesis for patient engagement and citizen engagement. And we have a discussion board, and people are putting in the board that they don't even know what constitutes what is evidence. So it's a really good question. And I think the issue is if we start at the top, we're not going to get anywhere. We kind of have to start at the bottom, and we have to go back to the basics and make sure that we're all on the same page as to what evidence is. And I talked a little bit about that competition, like is one study evidence? And that's a communication matter. And that, when we talk about our successes during the pandemic, one of the errors, one of the misses that I'm most upset about is at where we switched from the pandemic being transmitted by touch to being airborne. And I still have my 91-year-old aunt telling me every week that it's okay to play bingo in a room unmasked for 3 hours because the bingo caller washes off every card. There was a fail there to get that basic evidence that science evolves. So it's a really good question, and I think it's a good question for sophisticated citizens. And I think with our recommendation 13, we're trying to get to all of the other people who want to just have a grasp of evidence and try to make it, try to center it in their lives and understand what it is and what it isn't. So I'm gonna flip it back that way, if that's okay.
That's great, Maureen. So we're not sure whether you can use microphones or not. So, but I kind of wonder whether I might ask a few people to give a sort of a 2-minute sort of reflection, and at the top of the list, but I will go down the list is Ariel Bjorndal. Ariel, I don't know whether you can either unmute yourself and say hello and give us some ideas or responses, or whether you might, if not that, add some text into the chat or the live Q&A.
I don't think he'll be able to open his microphone. So,
okay,
Harold,
all right.
I hope that you can use the live Q&A. Yeah.
Okay, all right. So if you do have any comments or questions, I apologize about that. Please put them into the live Q&A. Okay, and I think we're starting to see people drop off. Okay, so I'm going to suggest I have one more or a couple more slides that I'd like to share with people.
There is one question, Jeremy, okay, in the live Q&A. Fiona Campbell, who is co-chair and editor of our Campbell Campbell Children and Young Persons coordinating group, She wrote, can Patrick expand a bit more on the comment that there is more in common across contexts than we think?
So Patrick, can you respond to that?
Can you hear me?
Yes.
I think.
Oh. So maybe while we're waiting for the reconnection with Patrick, I'd love to hear what he's got to say. I mean, I guess one comment, Fiona, might be that we often come to decision or suggestions that each of our places or our contexts are so different that we can't possibly learn from or generalize from other sort of settings, and they're often based on a fairly superficial sort of description of a context or a setting or an environment. Whereas I think we need to start to think about, what are the factors that would mean that something isn't transferable, and articulating what the mechanisms are for that. And so I think there's an issue about trying not to, the default almost is we start by saying that was done somewhere else, it can't apply here. But I think Jan also talked about potentially, I've had several calls with Jan in the last few days, so I'm not sure what it was, but actually there are considerable similarities that we can learn from. But Patrick, sorry, you look like you're unfrozen. Do you want to sort of say something much more articulate than that?
I didn't get the comment, and my live Q&A is not loading. But I know Vivian was saying something about a comment in the live Q&A.
It was, so Vivian, you can correct me if I'm wrong, but Fiona Campbell was asking if you could expand on your comment about there being more similarities across contexts and necessary differences. Vivian, is that kind of a good summary?
Yes.
Yeah.
Yes. So basically what we did was that we took a set of strands in the education sector, and this was based on a toolkit that was developed by EEF, and we sort of broke down the meta-analyses that were within these strands by interventions, and we used a mathematical formula to work with stakeholders to look at the results with respect to relevance, importance, complexity, and then we tried to use this. There's a mathematical formula that would let us predict how transferable that intervention, that research that was conducted in the north was to our setting. So based on this, we could find out that in the bulk of the studies, there are lots of things that are similar. In fact, there are certain interventions within, for example, participation that would be very, very similar to our set. Differences are usually very small, and this may come up in certain things like what you may need, which may be related to culture, but in the technology, we find out that there is not so much difference. So this is basically what we are talking about when we mention that there is more similarity than there is differences, but the differences could be very, very strong.
Wonderful, Patrick. And that's at least, I mean, that's one of the reasons why yesterday you awarded the Bob Baruch award in terms of that work. We're coming to the end. I just wanted to quickly say two slides, and I apologize because Sandy Oliver put a great question in the Q&A, but we don't have time to discuss it. What we hope is that the moment we have a small team that is trying to drive forward these three areas, and we're working with amazing people like Maureen and Jan and others. But what we hope is that the Evidence Commission will stimulate conversations around the world about how to do this better. What can we do? And so we'd encourage you to use, if there's anything in the Evidence Commission report that is valuable to you in your jurisdiction, to use it to engage in those conversations, to advance the arguments for evidence support systems wherever you are in whatever sector you're working within. If there are ways that we as a commission can help you. So if there are things, if you want further background or more access to our resources, then please let us know. Here are our website, our email address, and also you can follow us on Twitter. I'd really like to thank our 3 panelists today. It's been wonderful to be in the same room with them, and to thank you for your time today. And we're going to finish in 3, 2, 1. Thank you very much. Goodbye.